Hi friends, welcome back to my channel Mookambika Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam preparation. We are discussing one previous year questions and answers. First 75 question we already discussed. Today we can see from question number 76. Only we are discussing question and its answers. Question number 76. The volume of air in the lungs after a maximal inspiration is called. Options. Option A, vital capacity. Option B, tidal volume. Option C, inspiratory capacity. Option D, total lung capacity. Our question is, the volume of air in the lungs after a maximal inspiration is called total lung capacity. Option D is the correct answer. Our first option is vital capacity. Vital capacity means the maximum volume of air exhaled from the point of maximum inspiration. And second option is tidal volume. Tidal volume means the volume of air inhaled and exhaled with each breath is known as tidal volume. Or the volume of air breathed in and out during quiet respiration is known as tidal volume. And the next option, inspiratory capacity. Inspiratory capacity means the maximum volume of air inhaled after normal expiration is known as inspiratory capacity. Here our question is total lung capacity. Total lung capacity means the volume of air in the lungs after maximum inspiration is known as total lung capacity. Move on to the next question. Carcinoembryonic antigen is a tumor maker of. Options. Option A, colorectal cancer. Option B, germ cell tumors. Option C, prostate cancer. Option D, hepatocellular carcinoma. Carcinoembryonic antigen is a tumor maker of colorectal cancer. Option A is the correct answer. Move on to the next question. Question number 78. The prominent manifestation of thalamic hemorrhage is. Options. Option deep coma that develop immediately. Option B, pinpoint reactive pupil. Option C, contralateral hemisensory defect. Option D, occipital headache. Question is, which is the prominent manifestation of thalamic hemorrhage is? Contralateral hemisensory defect. Option C is the correct answer. Move on to the next question. Phantom limb pain is a type of. Options. Option A, somatic pain. Option B, central pain. Option C, sympathetically maintained pain. Option D, nociceptive pain. Phantom limb pain is a type of sympathetically maintained pain. Option C is the correct answer. Move on to the next question. Question number 80. A rifaximin is administered for. Options. Option A, vasoconstriction of splenic artery. Option B, prevention of viral infection. Option C, correcting hyponatremia. Option D, preventing release of ammonia in the intestine. Rifaximin is an example of antibiotic which is used to prevent the release of ammonia in the intestine. Option D is the correct answer. Question number 81. Sucralfate acts by. Options. Option A, conversion of pepsinogen to pepsin. Option B, cytoprotection of the gastric mucosa. Option C, improves esophageal and gastric emptying. Option D, increasing gastric motility. Sucralfate is mainly given in case of duodenal ulcer. So it acts by cytoprotection of the gastric mucosa. Option B is the correct answer. Move on to the next question. Appearance of U wave in ECG is the manifestation of. Options. Option A, hyponatremia. Option B, hyperkalemia. Option C, hypercalcemia. Option D, hypokalemia. Appearance of U wave is the manifestation of hypokalemia. Hypokalemia means decreased serum potassium level. Normal serum potassium level is 3.5 to 5.1 milliequivalent per liter. So in case of hypokalemia, the serum potassium level is below 3.5 milliequivalent per liter. And the ECG changes in hypokalemia includes ST depression, shallow, flat or inverted T wave and prominent U wave are the features of hypokalemia. Move on to the next question. Question number 83. Patients with Guillain-Barré syndrome are prone to develops. Options. Option A, respiratory acidosis. Option B, metabolic alkalosis. Option C, respiratory alkalosis. And option D, metabolic acidosis. And the correct answer for this question is option A, respiratory acidosis. Move on to the next question. Triple drug therapy for H. pylori infection include. Options: Option A, proton pump inhibitor, bismuth and tetracycline. Option B, proton pump inhibitor, bismuth and clarithromycin. Option C, proton pump inhibitor, amoxicillin and clarithromycin. Option D, proton pump inhibitor, amoxicillin and clotrimazole. H. pylori means Helicobacter pylori, which cause peptic ulcer, and the triple drug therapy for H. pylori infection include proton pump inhibitor, amoxicillin and clarithromycin. Option C is the correct answer. Move on to the next question. Question number 85. Metformin used in the treatment of diabetes mellitus. Options: Option A, it delays the entry of glucose into systemic circulation. Option B, inhibit the production of glucose by the liver. Option C, increases the number of insulin receptors. Option D, stimulates beta cells of the pancreas to secrete insulin. Question is, metformin is used in the treatment of diabetes mellitus because it inhibits the production of glucose by the liver. Option B is the correct answer. Move on to the next question. Question number 86. The most common method of spread of Ebola infection is? Options: Option A, droplets. Option B, direct contact with nose and throat secretions. Option C, contact with blood or body fluids. Option D, sexual contact. The method of spread of Ebola infection is by contact with blood or body fluids. Option C is the correct answer. Move on to the next question. Barrett esophagus is? Options: Option A, backflow of gastric content into the esophagus. Option B, ineffective peristalsis of the distal esophagus. Option C, dysplasia of the squamous mucosa of the esophagus. Option D, spasm of the esophagus resulting in the dysphagia. And the correct answer is dysplasia of the squamous mucosa of the esophagus. Option C is the correct answer. Move on to the next question. Factor hepaticus is the manifestation of? Options: Option A, hepatic encephalopathy. Option B, ascites. Option C, portal hypertension. Option D, hepatorenal syndrome. Factor hepaticus is the manifestation of hepatic encephalopathy. Option A is the correct answer. Move on to the next question. Clinical manifestation of peritonitis include? Options: Option A, abdomen soft on palpation. Option B, cold and clammy skin. Option C, rebound tenderness. Option D, shallow breathing. Peritonitis means it's an inflammation of the peritoneum, and its clinical manifestations include among the following: rebound tenderness we can see in case of peritonitis. Option C. Move on to the next question. Question number 90. Intermittent catheterization can be used as a treatment in? Options: Option A, urge incontinence. Option B, stress incontinence. Option C, overflow incontinence. Option D, functional incontinence. Intermittent catheterization can be used as a treatment in overflow incontinence. Option C is the correct answer. Move on to the next question. Question number 91. A drug that is contraindicated in angle closure glaucoma is? Options: Option A, pilocarpine. Option B, Damox. Option C, atropine. Option D, mannitol. Drug which is contraindicated in angle closure glaucoma is atropine. Option C is the correct answer. And the next question. Question number 92. Normal value of oxygen saturation of mixed venous blood is? Options: Option A, 35 to 45%. Option B, 45 to 50%. Option C, 40 to 60%. And option D, 60 to 80%. Then is normal value of oxygen saturation of mixed venous blood oxygen saturation. It is 60 to 80%. Option D is the correct answer. Move on to the next question. Identify the acid-base imbalance from the following blood gas analysis result. pH is 7.46. Partial pressure of oxygen 95. Bicarbonate 17. Partial pressure of carbon dioxide 28. Normal pH of blood is 7.35 to 7.45. Here pH is elevated. And normal partial pressure of oxygen is 80 to 100 mm of Hg. So partial pressure of oxygen value is normal. And bicarbonate value normal is 22 to 27. Here it is reduced. Bicarbonate is decreased. And partial pressure of carbon dioxide normal value is 35 to 45 mm of Hg. That also decreased. pH value is elevated and the partial pressure of carbon dioxide is decreased, that indicate it is respiratory alkalosis. So compensated respiratory alkalosis is the correct answer, option B. Move on to the next question. Contraindication to beta blockers include options. Option A, hypertension. Option B, tachycardia. Option C, bronchial asthma. Option D, portal hypertension. In which condition we are not giving beta blockers to the patient? It is bronchial asthma. Option C is the correct answer, because it can cause bronchospasm or bronchoconstriction. So we are not administering beta blockers to a patient with bronchial asthma. Move on to the next question. Question number 95. Most important nursing precaution to a patient with deep vein thrombosis is options. Option A, provide ROM exercise to the affected extremity. Option B, provide complete bed rest. Option C, mobilize the patient frequently. Option D, massage the affected extremity. And the correct answer is provide complete bed rest. Move on to the next question. Question number 96. Ultrafiltration in hemodialysis is effected by creating options. Option A, fluid gradient. Option B, glucose gradient. Option C, osmotic gradient. Option D, pressure gradient. Ultrafiltration in hemodialysis is effected by creating pressure gradient. Option D is the correct answer. Question number 97. Vasopressin act on which part of kidney? Options. Option A, proximal tubule. Option B, distal tubule. Option C, ascending limb of Lupus-Henle. Option D, descending limb of Lupus-Henle. Vasopressin act on distal tubule. Option B is the correct answer. Move on to the next question. Question number 98. During mechanical ventilation, the variable set on the ventilator to stop inspiration and to allow expiration is options. Option A, trigger variable. Option B, limit variable. Option C, PEEP. And option D, cycle variable. And the correct answer is, it is option D, cycle variable. And the next question, question number 99. The diet of a patient with nephrotic syndrome include options. Option A, high protein diet. Option B, normal protein diet with first class protein. Option C, normal protein diet with more plant protein. Option D, low protein diet. Here question, diet of a patient with nephrotic syndrome. In nephrotic syndrome, we should give more protein diet to the patient. So here the correct answer is normal protein diet with first class protein. So we have to add more protein in the diet. Option B is the correct answer. And the next question and last question, question number 100. Costovertebral tenderness is a characteristic feature of option A, pancreatitis. Option B, cholecystitis. Option C, cholelithiasis. Option D, pyelonephritis. Costovertebral tenderness is a characteristic feature of pyelonephritis. Option D is the correct answer. So here we discussed 100 questions from previous year question papers, and surely these questions will helpful for your exam preparation. If it is useful for your studies, please share my videos to your friend circle.